Welcome to It's Your Case, presented by VetCT.com. I'm Heather. Here is a 5-year-old female spayed German Shepherd dog. She presented with chronic low-grade forelimb lameness. Once you've reviewed the radiographs using a systematic approach, then you're ready to watch this video. Now, let's start with the lateral view of the vertebral column. I'd like to, when I look at the vertebral column, I often start by focusing on the intervertebral disc spaces. When I look at the intervertebral disc spaces, I expect to see relatively uniform width and very smoothly margined end plates. Look at the difference between T12 and T23. You'll see that at T12, there's evidence of reduced opacity and irregularity of the end plates. Compare that to this very smooth appearance at T23. I'm also suspicious of a reduced opacity here in the cranial end plate of T1, but it's on the edge of the film and there's a bit of obliquity, as well as the rib head is superimposed slightly. Let's pursue these impressions on the ventral dorsal view. It can be quite tricky, especially in deep-chested dogs, and because of superimposition, to get a lot of information out of ventral dorsal views of the thoracic spine. However, my overall impression is that if I look at T23 here, that I see a relatively well-defined joint space at the disc. When I look at T12, I see that there's just a generalized lucency in this area. So taken together, when we compare our impression on the lateral view as well as the VD view, these findings are highly consistent with discospondylitis. In German Shepherd dogs, we know that discospondylitis can be bacterial or sometimes fungal, most notably aspergillosis. The relationship of this to the front limb lameness needs to be correlated with orthopedic and neurologic examination. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.